My name is Aston. My name is Aston Morgan. I am with Black Health Matters. This session is prostate cancer in African-American men, something that, quite frankly, pretty dear and near for me. But African-Americans have the highest death rate and the shortest survival of any racial and ethnic group in the US from most cancers. 1 in 7 Black men have a chance of developing prostate cancer in their lifetimes. According to Memorial Sloan Kettering Cancer Center, they are 50% more likely to develop prostate cancer and 2 times as likely to die from the disease. Please join the esteemed Dr. Keith Crawford and Thomas Farrington for the discussion exploring the genetic risks associated with prostate cancer, early detection and treatment, and ask plenty of questions. These guys are well versed. Enjoy.
Hello, I am Thomas Farrington. I am the founder and president of the Prostate Health Education Network, and I welcome you to the session today. I am a 21-year prostate cancer survivor. I have seen prostate cancer up close and personal all of my life. My father and both grandfathers died from prostate cancer. When I was diagnosed with prostate cancer in the year 2000, what I realized was that even though I had watched prostate cancer up close, that I really didn't know anything about the disease. I didn't realize that I was extremely high risk of being diagnosed with the disease. And I didn't realize that I was also had a very high risk of not surviving the disease like my father and both grandfathers. So what I decided to do was to really study prostate cancer in depth. And this is something that I took time to do. My background, I founded a computer software company when I was 25. And at the time that I was diagnosed with prostate cancer, I was kind of unwinding from the IT business. And so I literally had time to study the disease. And after spending time studying the disease and spending time also with men that were in treatment with me, I decided to write a book in hopes that this book would help alert men, especially Black men, about their risk, give them some understanding of prostate cancer, and really help eliminate the silence around this deadly disease. This book, which I released in 2001, 1 year after I was diagnosed and treated, I spent a lot of time then speaking out about prostate cancer, the different organizations and communities where I lived and other communities around the country. And this led me to found the Prostate Health Education Network in 2003. Founding PHEN in 2003 was quite an experience. Prostate cancer is a leading cause of cancer among Black men. Approximately 250,000 men would be diagnosed with prostate cancer in the US in 2021. Black men are diagnosed at a rate 75% higher than white men. We die at a rate 120% higher. And this represents the largest racial disparity for any type of cancer for men or women. This is something that I really wasn't aware of. And it is something that unfortunately too many of us are not aware of, or we're not on alert for this deadly disease. In founding PHEN, my objectives were to raise awareness and knowledge within Black America about prostate cancer. I wanted to mobilize Black prostate cancer survivors in the fight against prostate cancer. I wanted to gain support from industry, community, and political leaders towards eliminating the prostate cancer disparity. Since then, we have created programs that we carry out all across the country. We have more than 1,000 active what we call PHEN ambassadors. These are survivors who, like myself, wanted to give something back. They wanted to contribute what they had learned facing prostate cancer. They want to contribute that knowledge to others in hopes that it would really make a difference in their success in fighting the disease. When I was diagnosed, I didn't hear a thing about prostate cancer from community leaders or political leaders, almost nothing from anyone. So we have engaged pharmaceutical industry, churches, political leaders all across the country to get them really engaged, because we need, in order to be successful towards eliminating the disparities, we need the support and the involvement of survivors and leaders everywhere. Now, one of the things that we certainly understand clearly is that knowledge is the best defense against prostate cancer. This is something that we point out to most everyone when we began discussion with men who are at high risk. And all Black men are at high risk for prostate cancer. It's not just men like myself who have a family history, but if you're Black, you are at high risk for prostate cancer. If you're Black like myself with a strong family history, I'm at even higher risk. But you are high risk even if you don't have that family history. So knowledge about early detection is critically important. When do I begin PSA testing? What is PSA testing? What is the prostate? That knowledge is important. Early detection is a key to surviving prostate cancer. So I say this to the public, those of you who are not survivors, but those of you who are just walking the streets every day, you need knowledge about prostate cancer. And that's one of the things that we spend a lot of time focusing on. How do we educate the public, the Black men and women, about their risk for the disease and what it is that they should do if they should be diagnosed? We also know that if you are diagnosed, knowledge about treatments is critically important. You know, I spent a lot of time when I was diagnosed with prostate cancer trying to decide what treatment would be best for me. You know, it's interesting, and I write about this in my book. I decided to have surgery, and I spent a lot of time preparing for surgery. But the more I studied, and I pointed this out when I first began, that I had time to really study this disease. But the more I studied, the more I realized that surgery may not be the best option for me, because, you know, my stage told me that even if I remove the gland itself, there was still more than a 50% chance that cancer cells would remain and that I would face prostate cancer progression even without the gland. Now, a lot of people believe that, and I've heard men say this, I'm diagnosed with prostate cancer, I decided to have surgery to get rid of it, and then it's all over. That's not the case. That's reading knowledge about treatments is so critically important to those men who are diagnosed with the disease. And, you know, I decided upon surgery the day before I was to check in for surgery. I walked away from all of my doctors and decided not to have surgery. And I took more time to find the treatment that I thought was best for me. And, you know, I've been on a 21-year prostate cancer journey. Not always smooth, but I am here 21 years later without any really major prostate cancer problems. So treatment knowledge is critical. And then the other thing is survivorship. You need to know I can have a recurrence. What is this thing about clinical trials? What do I do about sexual health? What do I do about incontinence? There are options for all of those. And so knowledge in these areas is so important. And so what we've done with PHEN is to have a strong education and awareness program that we carry out with a number of different initiatives. And we also have created tools for patients and the public to use to increase their knowledge. We believe that focusing on this awareness and knowledge will help and has helped countless men face prostate cancer successfully. Now, at this point, I am pleased to introduce Dr. Keith Crawford. And Dr. Crawford is our Director of Clinical Trials and Patient Education. And he's going to spend some time talking about our different programs, our different tools. How do we provide knowledge? How do we put in your hands what you need to face prostate cancer successfully? So Dr. Crawford, please take over.
Hey, Tom, thank you very much. I want to also thank the folks at Black Health Matters for us having this opportunity to talk to you about prostate cancer. So I'm going to share my screen right now. So as Tom mentioned, I'm the Director of Clinical Trials and Education. So I'm going to take you through some of the tools that we use to educate. And it's important to recognize education without community is very difficult. So that's one of the things we have men, and part of the PHEN members help educate you also. So we wanted to alert everyone to this fact. Now, you may not have heard it in the news, but the American Cancer Society, when you look at their numbers, estimate 30% increase in the number of prostate cancer cases in 2021. Now, this is the largest increase for any cancer. Now, what's important about this is that there was a time when cancer was dropping. Now it's starting to increase in the population. Let me explain also, this 30% increase is not related to COVID. So above this, there will be an increasing number of people that are, because of delay in screening and treatment, there'll be an increase. So what we want to do is first talk about PHEN's Prostate Cancer Disparity Rally. And so to address this, we launched Leaders and Patients Speak Out public service announcements. So we have that project where we work with patients and clergy, medical professionals, federal and state elected officials, caregivers to raise awareness. And we use our online resources to provide education and guidance to detection and screening and treatment options and in clinical trials, for clinical trials. And we also nationally promote the Prostate Cancer Rally through local news, social media, radio, television, print, and through our PHEN community. Now, some of our program initiatives, and if we break them up into the three categories, one is the community awareness and outreach, the other is online education, and then last, we have an annual African American Prostate Cancer Summit. Tom did not mention that prior to COVID, we always hosted a summit in September on Prostate Cancer Month on Capitol Hill. So we had the opportunity not only to educate the people around the country, but also educate members of Congress. So Tom mentioned that prostate cancer is a continuum. Prostate cancer treatment is a continuum. But prostate cancer education and awareness is a continuum. And there's another thing too that is important, is that our objective is to decrease the disparity of prostate cancer inside the African American community, but we create tools like our screening, early detection screening program from African American men, which we use Dr. PSA to discuss. So this is a portal. This is something that you don't have, it's not an app. You can go on your phone, type in phenpsa.com, and it'll take you to this website. And this website will give you key information that you need to know when you're thinking about, or it's suggested that you think about or talk about prostate cancer screening. So you may have a lot of questions. What is the prostate? By going here, you can get an idea and images and a small informational tutorial about the prostate and prostate cancer. Then may have a question, early detection screening. Why is that important for African-American men? So there are a lot of questions that you may have that we can educate and provide information for. So when you sit down with your doctor, you'll be able to ask these questions. What is the prostate cancer? What is prostate cancer and what is prostate? Why is early detection screening important for Black men? What age should men begin early detection screening? And so on. So remember, if you're earlier on and you're concerned about when you should start testing, go to PHENPSA.com. Now, what happens after you've been diagnosed? Tom gave you his history. He had to take time, a couple of months, to kind of figure out what's going on here. And so he didn't know. And so he's perplexed. It's so much information. You have to, once you receive that diagnosis, what treatment options are you going to use? I mean, most people are lost, confused, unsure, perplexed, disoriented about what the next approach is. So what we did was create another online tool that helps guide you and review all the treatment options that are available to you. This isn't like going on Google. We're basing this information, PHENPath.com, is based upon the National Comprehensive Cancer Network's guidelines. These are the guidelines and treatment guidelines that doctors use. And you will have it right there on your cell phone. So you can either at home or when you're sitting with your clinician, you can talk about hard facts. And this is the type of information you're a clinician, that you're a caregiver needs to have when you have it making that decision. So I always like to lead with this message. Tom is a 21-year survivor. And through that period of time, there was significant challenges at identifying treatment pathways and what was most appropriate for himself. So he personally designed this PHENPath to support the needs of all prostate cancer patients as they travel along their personal journey. And this is important. So here's the treatment pathways. We keep everything simple. Remember, we base it on guidelines from NCCN, a reputable United States cancer organization. And we break it up into what happens if you're initially diagnosed versus you have recurrent disease. Your PSA comes up after surgery or radiation. Do you fall in the category of advanced hormone sensitive cancer? What about castration resistant? These are terms that you will hear. And so now, again, whether it's on your phone, your tablet, or on a computer, you'll have access to it that doesn't require you to download an app or give your personal information. So why is this important? In the past, a clinician, a doctor would have the diagnosis and then tell you what the treatment options are. Now, what PHENPath allows us to do, it allows the patient to participate in an informed, shared decision-making process. Now, you can take the doctor's recommendation and the knowledge that the patient has to have a bidirectional communication. And then, depending on your values, your preferences, you make the decision on the type of care you want. So just the same as you saw with PHENPSA for early detection screening, now you have PHENPath.com for helping you guide you through this, your treatment pathway journey. Now, all of these are on mobile devices and computers, in your computer. Next, what people don't recognize is this: clinical trials are part of your treatment options. Now, has a doctor or anyone talked to you about clinical trials? Because that's a major reason why a lot of African Americans and people in general don't participate in clinical trials. So what we do to help educate not only African American men, but all men on their prostate cancer journey, we created a tool. And this tool will allow us to do one thing, and that's help increase the number of African-American men in clinical trials. Now, what we do know right now is the number of African-American men is significantly low in clinical trials, about 4%. Now, researchers at the School of Public Health at Harvard and across the country have stated that African-American men need to participate in high enough levels so the information generated will be relevant, can be generalized. And so that means that at a minimum, 22% of the participants in clinical trials should be Black. So again, a message from Tom, and this is something that everyone has to hear. We cannot be left behind with new treatments if we're going to eliminate the prostate cancer racial disparity. This is Tom, and this is what the mission is. This is what our objective is. Our objective is to increase participation in clinical trials. Now, how would we do that? We first started out with several activities. Again, as you noted before, we had a portal for early detection screening. We have a portal, again, for treatment pathways. We also have a portal for clinical trials, and it's phentrials.com. Now, we have highlighted patient summaries and other educational material. Now, we use these simple patient summaries that we get from our sponsors, and we use these to help inform and educate the patient. But we just don't give a patient these simple summaries, or you don't have access to those on the computer. We create newsletters, and these newsletters highlight specific trials and educational topics. And then we have educational presentations and briefings, not just in the community, but all across the country. And since post-COVID or during COVID, we've completely expanded where all of our educational briefings so far have continued online. But not only that, we created something called Find Your Trial. And this is our tool that allows you to understand or identify those trials that are specific to your disease state. But there's one thing I want you to remember. All this online, computers and handheld smartphones are important, but you can't forget one-on-one clinical trial navigation and support. And that's something we always do, because you can pick up the phone and you can call us and we can help guide you. Not only at our home office in Boston area, but across the country, because we have navigators, we have members throughout the country. So
Dr. Crawford, I hate to cut you off, but I think we have 5 minutes. And so what we want to do is, I think, maybe answer a couple of questions before we have to leave. And I do see some questions here. I see one that my husband's numbers have gone up over the years, but cancer hasn't been detected. He's a veteran, and we have to push every bit of care imaginable related to treatment. And we do understand that. But if your husband's numbers have gone up over the years, there is, in all probability, cancer progression. You should certainly talk with your provider, your Veterans Administration, about imaging to be able to detect where the cancer may be. And if, you know, a lot of times you have a biochemical recurrence, and this is something, if you look at phenpath.com, we'll send you back to that again. There are approaches for that. There is another question here. There seems to be so many different treatment options. How do they differ? And again, I'm going to refer you back to the presentation that Dr. Crawford presented about PHEN-PATH. You're absolutely right. There are many different treatment options for prostate cancer. And but if you go back to PHEN-PATH, the options differ based upon where you are along your prostate cancer journey. The options are different if you are newly diagnosed. They're different if you have recurrence from surgery. They're different if you have recurrence from radiation. They are also different if you have cancer that no longer responds to androgen deprivation therapy, which is called castration-resistant prostate cancer. So go to phenpath.com and you will get a good understanding of about the different treatment options. And this will allow you to talk with your doctor about the best treatment option for you. How important is diet is another question. The diet is also always important for good health, and it's also important for good prostate health. There's been a lot of studies about specifically a diet for prostate cancer, and the only thing that I would say is that just diet is good. There's been no magic bullet diet for prostate cancer. Unfortunately, you know, one time people thought that tomatoes was a good for prevention for prostate cancer, but studies show that that really wasn't the case. So just have a good diet and good health. Let's see, do we have any other questions here that we may have missed? Nowadays, I've had questions regarding the physical test only versus doing blood work. What should we do? The physical test only versus blood work, I don't know who would tell you that, but it's just the opposite. You do your PSA test. If you have your PSA test, that's the most important, because as Dr. Crawford pointed out, if you have your PSA test, which may appear abnormal, approach now that's preferred by many doctors is then go to imaging. And then the imaging can really help determine, is there anything that shows cancer? And then from there, you can have a physical test, you can have a biopsy, but usually the PSA test is the most important, and that would lead the way for all tests after that. I don't see any more.
I said you might want to comment. There was one question about the PSA being different. So versus.
Oh, yes, okay.
Yeah.
Right.
So
yeah,
go ahead.
Your PSA can certainly vary, and you know, it depends upon how much that variance could be. Because you have a high PSA, it doesn't mean you have prostate cancer. You could have prostatitis, which is inflammation of the prostate gland. If you have, you know, if you take a PSA test following sexual activity, your PSA could be high, as opposed to if you took it when you did not have sexual activity. And so things like that are important. I have a note that we need to close the session now. I just want to invite everyone to go to our website. It's Rally Against Prostate Cancer, rapcancer.org, rapcancer.org. And from there, you can find more information on everything that we discussed today. And we invite you to join us in the fight against prostate cancer. Thank you. And thank Black Health Matters for this opportunity.
Thank you. Good night.